Have voted to reopen the government, but pressure continues to build. State representatives are calling on the government to make a decision on the continuing resolution for health care. Our Bralise Pimentel is following that story. Bralise.
Today, South Carolina Congressman Jim Clyburn calling this a health care crisis. He says the government continues to fail at extending the Affordable Care Act tax credit. Attorneys and insurance companies agree with Clyburn and say many will suffer if Congress doesn't act.
It's going to be absolutely devastating. We're going to go back to levels of uninsured that we saw pre-Affordable Care Act. And when we go back to that, it's not just going to impact the folks that immediately lose their insurance, but it's going to impact all of us.
Sue Berkowitz of Appleseed Legal Justice speaking out after Congressman Jim Clyburn said Wednesday morning that the government hasn't extended the Obamacare tax credits that have kept health care affordable. In a statement, he says he opposes the government's continuing resolution, saying, quote, "As a result of this bill, Americans will continue to experience painful sticker shock when they see their new health care premiums. Millions will be forced to go without coverage."
So what we're talking about are the poorest of the poor. Those who can least afford to not have insurance are going to go without. And when we see the 185,000 people who will probably lose their health care if these EPTCs do not go forward, it is going to have a ripple effect throughout our state.
Berkowitz says without the extension of health care tax credits, families will have to make tough decisions when it comes to doctor visits. Joel Laurie, the president and CEO of Laurie Life and Health, says the middle class will feel the impact the most.
So a 40-year-old couple who falls right under 400% of the poverty level, making $84,000 a year, would qualify for about a $450 a month subsidy, and it would bring the cost of their health insurance down to about $500 a month. If they made just a couple $1,000s more, so as opposed to making $84,000, they made $86,000 a year. If the subsidies don't get extended, they lose their subsidies, and they'll be paying close to $1,000 a month.
Laurie says that's just for a basic plan with a deductible and out-of-pocket copays. He says Congress needs to look at every person that could be impacted if subsidies aren't extended.
I think it's very important that people call their congressmen and women and say, look, this may be a political headline, but this affects my family. This affects whether we can afford health insurance next year or not, or who in our family is going to be able to get health insurance. And the rest, we're just going to have to go on a wing and a prayer and hope they don't get sick. And that's not what we should be as a country. That's not a great way to provide health care to the American people.
Joel Laurie says everyone should get with an agent they trust to go over health care options if subsidies don't get extended. In Columbia, Bralise Pimentel, Watch Fox News, Local First.